Blood transfusion observation involves the systematic monitoring of a patient's vital signs, comfort, and response during and after a transfusion to ensure safety, detect adverse reactions early, and document the procedure's effectiveness. To record blood transfusion observations, follow these steps. Navigate to the clinical module and select the Inpatient panel. As shown, in the new window that opens, a list of admitted patients will be displayed. Select the patient you wish to attend to. If the list is extensive, you can use the search bar to easily find and select the patient, and click on the Actions button and select Inpatient. From the menu list, choose Blood Transfusion Observation. In the next window, fill in the required fields. Input the date of the transfusion, as accurate dating is essential for patient records and tracking. Select the type of blood being transfused to ensure compatibility with the patient's blood type. Record the blood unit donor number, which helps trace the blood source and manage any potential complications. Document who checked the blood counter, as verification by a second person is crucial for safety. Indicate who initiated the transfusion to ensure accountability, and log the exact time the transfusion started to help monitor the duration and flow rate. Specify the rate of transfusion, as proper rates prevent complications like fluid overload. Record the time the transfusion ended, which is critical for assessing the total transfusion duration, and document the total amount transfused to ensure compliance with transfusion guidelines. Note the role of the person overseeing the transfusion to maintain a clear chain of responsibility. Additionally, record any symptoms observed during the transfusion, as timely identification of reactions is essential for patient safety. Document any interventions taken in response to observed symptoms for future reference and patient care. After completing these entries, click the plus button to save. To chart items, select Blood Transfusion Observation from the View window, and then click on Chart Items. In the subsequent window, fill in the required details, including the total hours observed for the patient during the transfusion, which helps track monitoring duration and ensures safety. Note the exact time for each set of vital signs, as accurate timing is essential for monitoring changes over the transfusion period. Measure and document the patient's blood pressure, as monitoring changes can indicate adverse reactions to the transfusion. Record the patient's temperature, since any significant changes may signal a transfusion reaction. Monitor and document the pulse rate, as fluctuations can provide vital information about the patient's response to the transfusion. Assess and record the respiratory rate, as changes in breathing patterns may indicate complications. Finally, add any relevant remarks, as documenting observations and any unusual findings is crucial for ongoing patient care. Click the plus button to save these entries. To view the blood transfusion observation report, close the current window. In the subsequent window, click on Generate Report. In the report window, you can share the report via email, download it in various formats, or print it directly from your browser.